Assalamu alaikum wa rahmatullah, and welcome to our second part from this training, pressure ulcer from A to Z. And this is Abdul Karim Blasi. Welcome to our training. In the last period of time, we already described all the basic necessary information about the pressure ulcer. We define the pressure ulcer, and we know what are the differences happen in differentiating the pressure ulcer. We understand more that about the guidelines, how the other international panel of experts classify and describe the pressure ulcers. We are now able to know more about the description of the pressure ulcer. What are the skin injuries, the other skin injuries that can confuse us in dealing with the pressure ulcer. Now, we will go more for the practical side of this course. Practical side, that means how we will treat the pressure ulcer. What are the best treatment modalities that will guide us to provide the proper decision in making the dressing for the patient, and also to choose a comprehensive treatment plan. We will start in this course by describing first what are the tools that will help us to assess the pressure ulcer. And it's not only assessment, rather than also to tell us if we are dealing and progressing the pressure ulcer treatment in a proper way. Then we will go for the wound bed preparation theories. What are the theories that describe the methods of treating pressure ulcer? How we will describe the wounds and what are the conditions or terms that we should take it in consideration. Let's hear the first principles that we are taking in. Let's state that we are dealing with this wound. And let's to say that this is a pressure ulcer. Pressure ulcer, I inform you, it's come on the sacral area. So we are talking here about some red in color. Here we have some spot of black color, maybe here bone exposed, bone, and here some black tissues. First principles in defining what you are in need to use to treat these wounds. We will look for this picture or this wound as you are dealing with clock. Here, let's to imagine that we are talking about clock, while 12 is the head of the patient, and instead of head down on the other part, it will be 6, which is the toe of the patient. That means the space of the wound from here to here will make like the length, and here will be the depth from 3 to 9. In this image, we are able now to deal with the wound 12, 6. Now, in the description of the wound, we will have the principles as we described it before, 3 by 3. What are the first 3? It's the peri-wound area, is the wound bed, the wound edge, and the wound bed, right? And under of this one is the 3 categories, and this is what we are looking to describe the wounds, or the methodology of how we will evaluate or describe what we are in need to deal with it. Now, the issues that's come with us here, like describing the wounds and all of this description, as we discussed in the last vlog, it's a qualitative description. Qualitative, it's a narrative, right? I will say, for example, here to say from 4 until 6, we have here this discoloration or this red color. At 6, maybe we have tunnel here, or maybe we have undermining in this area. We have bone exposed in this area. We have all of this one. It's described as qualitative part, narrative part. But how we will describe or transfer these issues to be numeric, then we are able to define where is the issues need for improvement.